If you are over 50 and your doctor just said prostate surgery, I know that knot in your stomach right now. The sleepless nights wondering if you will ever feel normal again. Paul was 57, running construction crews and feeling invincible when his urologist dropped the bomb about his PSA levels. But here is the shocking truth about what happened next that will completely flip everything you think you know about prostate surgery. Hit that button if you have ever sat in a doctor's office feeling completely overwhelmed by medical decisions. Here is what we are covering today. First, the 5 questions that separate men who thrive after surgery from those who struggle. Then the recovery timeline your surgeon probably glossed over in 30 seconds. And finally, the preparation system that Paul used to shock his own medical team with his results. Paul thought he understood what he was signing up for. Surgeon removes prostate. Cancer gone. Life continues. Wrong. Dead wrong. And if you are facing this decision, you are about to discover why 90% of men walk into surgery completely unprepared for what really happens next. Let me paint you a picture of that consultation room. Paul is sitting there, construction-hardened hands gripping the chair arms, while his urologist rattles off statistics about 5-year survival rates and surgical success percentages. Sounds reassuring, right? But here is what that doctor never mentioned once during their 40-minute conversation. What Paul's Tuesday morning routine would look like 6 months later. Here is the brutal reality about prostate surgery that most men discover too late. The medical establishment has gotten incredibly good at removing prostates and eliminating cancer, but they have failed miserably at preparing men for the psychological and physical journey that follows. Memorial Sloan Kettering research reveals something disturbing. The consultation process focuses 90% on cancer elimination and only 10% on quality of life recovery. Comment below if you have ever felt like doctors rush through the lifestyle impact conversation. That is when Paul made the decision that changed everything. Instead of scheduling surgery immediately, he said something that stunned his urologist. "Doctor, I need 2 weeks to research this properly." His surgeon actually tried to discourage him, saying, "Trust the medical process." But Paul's construction background had taught him something crucial. You never start a major project without understanding every phase of the build. What Paul discovered during those 2 weeks will shock you. Johns Hopkins research shows that men who actively prepare for prostate surgery do not just recover faster. They report completely different life experiences afterward. We are talking about 40% better outcomes across every metric that matters: energy levels, confidence, relationship satisfaction, and return to normal activities. Actually, recent research reveals something that will blow your mind about surgical outcomes. It is not the surgeon's skill level that predicts whether you will be thriving or struggling 1 year later. Harvard Health data shows that patient preparation accounts for more outcome variation than surgical technique itself. Think about that for a second. Your preparation matters more than your surgeon's technique. But here is the thing that makes me angry about how this process typically works. Doctors focus on the 1-day surgery and completely gloss over the 90-day recovery that determines your actual quality of life. They will spend 30 minutes explaining surgical approaches and 30 seconds on what your first month home will actually feel like. Wait, let me show you something that will change how you think about this entire decision. Paul uncovered 5 critical preparation factors, and not one surgeon had mentioned any of them during consultations. These are not medical secrets, they are documented in research, but somehow they never make it into the standard consultation process. Let me break down Paul's preparation system that transformed his surgical experience. First pillar, surgical approach education. Paul discovered there are 3 main surgical options, and most men never understand why their surgeon chose their specific approach. Open surgery, laparoscopic surgery, and robotic-assisted surgery each have different recovery profiles, but surgeons rarely explain these differences in detail during consultations. Robotic-assisted surgery typically involves smaller incisions and potentially faster recovery, but it requires surgeons with specific robotic training. Open surgery provides surgeons with direct tissue access, but involves larger incisions and longer recovery periods. Laparoscopic surgery falls somewhere between these approaches. The key insight: your surgeon's experience level with their chosen technique matters more than the technique itself. Drop a if you think patients deserve complete information about their surgical options. Second pillar, physical preparation that most men completely ignore. Harvard Health research shows that men who spend 4 to 6 weeks optimizing their fitness before surgery recover 40% faster than those who do not prepare. We are talking about cardiovascular conditioning, pelvic floor strengthening, and nutritional optimization that directly impacts healing speed. Paul started walking 5 miles daily and doing specific pelvic floor exercises 6 weeks before surgery. His physical therapist taught him exercises that most men never learn until after surgery, when their bodies are already compromised and learning is more difficult. Which of these preparation strategies sounds most challenging to you? Let me know in the comments. Third pillar, building your recovery support network before you need it. Most men think their spouse and maybe a close friend will handle everything. Wrong again. Paul discovered that successful recovery requires specific types of support. Someone who understands the medical process, someone who can provide practical daily assistance, and critically, connection with other men who have navigated this exact journey. Fourth pillar addresses something doctors barely mention: the psychological preparation for major surgery and recovery. Recent studies demonstrate that men who participate in counseling or support groups before surgery report 50% less anxiety and significantly better pain management during recovery. Paul joined an online support group for men facing prostate surgery, and he told me this was the single most valuable preparation step he took. Hearing from men 6 months and 1 year post-surgery gave him realistic expectations that no medical consultation had provided. Fifth pillar, it is not about medical preparation at all. It is about developing what Paul calls recovery milestone literacy. Most men have no idea what normal healing looks like week by week, so they panic at normal recovery experiences or miss signs of actual complications. Cleveland Clinic research shows that recovery timeline literacy reduces emergency room visits by 30% and increases patient satisfaction scores dramatically. Paul created a detailed recovery calendar based on research and survivor experiences, and he knew exactly what to expect during each phase of healing. On surgery day, Paul was calm and confident while other men in his recovery ward were anxious and unprepared. His nurses commented that they had never seen someone so prepared for the recovery process. Here is the reality about post-surgical recovery that most men discover the hard way. Urinary control issues affect virtually every man immediately after surgery. But here is what they do not tell you. Recovery happens in predictable stages, and knowing these stages reduces anxiety dramatically. Most men regain significant bladder control within 6 to 12 weeks, but full recovery can take up to 1 year. Tell me in the comments, if you knew the recovery timeline details up front, would that change your anxiety level about surgery? Sexual function recovery deserves honest discussion because this affects every man differently. Research indicates that nerve-sparing surgical techniques can preserve erectile function in many cases, but recovery timeline varies from 6 months to 2 years. Age at surgery, preoperative function, and postoperative rehabilitation all influence outcomes significantly. Paul's approach to this aspect of recovery involved frank discussions with his surgeon about nerve-sparing techniques, realistic timeline expectations, and available rehabilitation options. His preparation included understanding that recovery would be gradual and that multiple treatment options exist if natural recovery does not occur completely. 6 months after surgery, Paul was not just cancer-free. He was more confident about his health decisions than he had ever been in his life. His recovery milestones met or exceeded every research-based expectation he had established during preparation. But the most important outcome was not physical recovery. Paul discovered that becoming an educated healthcare participant transformed his relationship with medical decisions permanently. He went from passive patient to informed advocate for his own optimal outcomes. Imagine yourself approaching any health challenge with Paul's level of preparation and confidence. Research consistently shows that men who invest time in understanding their medical options and preparing comprehensively report higher satisfaction across all specialties. Even Paul's surgical team commented on his exceptional preparation level and how his realistic expectations contributed to his smooth recovery process. His experience proves that patient education and preparation significantly influence both surgical outcomes and long-term satisfaction. This applies whether you are facing prostate surgery now or want to be prepared for future health decisions. You have the power to become an informed participant in your health care, rather than simply accepting recommendations without thorough understanding. I used to think that surgical outcomes were entirely in the surgeon's hands, but research proves that patient preparation and education play massive roles in determining recovery success. Men who approach surgery as educated participants consistently achieve better outcomes than those who remain passive patients. You have got a choice right now about how you will handle major health decisions. You can accept standard medical recommendations without investigation, or you can follow Paul's example and become an educated advocate for your own optimal outcomes. Your next step is straightforward. Start building your health education foundation now, before you need it. Research shows that men who understand medical processes and recovery timelines navigate challenges with significantly less stress and better outcomes. I am monitoring emerging research about enhanced recovery protocols and improved surgical techniques that could revolutionize prostate surgery preparation. New studies about prehabilitation, preparation plus rehabilitation, are showing even more dramatic improvements in surgical outcomes. If you are watching this, you are already doing better than most men by seeking comprehensive health information. Subscribe to Strong Roots so you do not miss updates as new research emerges about men's health optimization and medical preparation strategies. Next week, I am diving deep into robotic prostatectomy, the latest advances in minimally invasive techniques and what they mean for recovery outcomes. Make sure you are subscribed because these technological advances are transforming the surgical experience for men worldwide.